After a fall and a swiftly completed check-up at A&E, Doreen is ready to go home. Unfortunately, she's been waiting 6 hours for the ambulance to take her there.
I just had enough now. My head's hurting and my mouth's terrible.
You want to get home?
You shouldn't come near me.
In many hospitals, Doreen would take up a bed until transport arrived. But the Royal Albert Edward Infirmary in Wigan has opened this discharge lounge, one of several pioneering approaches it's taking to free up bed capacity.
Spoke to doctors, spoke to carers.
Here's another, a special team of nurses patrolling A&E to identify as early as possible the kind of patient likely to end up medically fit but unable to leave.
Hello. Are you okay? Just been on the phone to your daughter, spoke to your carers as well.
Often it's the first official help someone gets.
And that's starting everything from scratch, involving social workers, involving their own GP. If they haven't visited the GP for 20 odd years, then nobody's aware that this patient's struggling until they hit the front door of A&E.
Bed 7, we're waiting social services.
Even if care arrangements are in place, the system isn't geared to the hospital accessing them easily.
I think if we could have a single point where we can all access the same records, would make things a lot easier. And if people worked out of hours and weekends as well, not just us, if services didn't stop necessarily out of those hours, then that would clearly make a big difference.
All right, where are we up to, Kim?
It's Debbie's job to find every bed in the hospital that's coming free
2-1 needs a respiratory bed.
and identify the ones occupied by people stuck in the system.
How does it feel when you know somebody spent 7 hours on a trolley,
Yeah. It's hard, it's difficult, but we've got to deal with what's in front of us. We've got to deal with the people that are coming through the door. It is difficult and it is pressured.
Back at the discharge lounge, Percy Gibson and his wife Helen are pleased he didn't require a stay in a bed.
We're not waiting in a nicer place, really, have we?
Avoiding admitting people and swiftly discharging them may be a top priority, but delays throughout the system still mean this winter record numbers of beds have people in them who'd be better off out of hospital. Catherine Jones, 5 News, Wigan.